Okay, guys, let's talk about the basics of cardiogenic shock. So, the initial insult here in cardiogenic shock is going to be a broken or blocked pump. So, there's three main causes. The first is a myocardial infarction. Remember, dead heart muscle can't pump. Cardiac tamponade, which is when fluid builds up around the heart and it puts pressure on the heart, so it makes it harder to pump. And the other one is a PE, or a pulmonary embolism, that keeps the blood from moving forward to the lungs, and so it causes it to back up. So the big thing we want you to see here is this is like extreme version of heart failure, okay? So the blood can't go forward, so it backs up. So we have this backup of fluid here, and what we're going to see is that increased preload. So again, fluid can't go forward, it backs up. Our preload is going to be increased. Our filling and our stretch on the heart is going to be increased. Now, since the blood can't go forward, this is our bad pump. We're going to have a decreased cardiac output, decreased blood pressure, right? And just like we saw in hypovolemic shock, our body tries to compensate. So when we have that decreased cardiac output, our heart rate is going to increase to try to compensate for that decreased output. And then we also see that vasoconstriction to try to shunt blood to the vital organs and back towards the heart. Okay, so that vasoconstriction causes our afterload to increase. Remember, afterload is measured by SVR. Okay, so can't go forward, so we have an increased preload, decreased cardiac output and blood pressure. Our compensation is increased heart rate and an increased SVR. So again, we're shunting away from our non-vital organs and towards our vital organs. So what we're left with basically is this pumping system that is entirely broken and vital organs that are not getting the blood that they need. So what does this look like in our actual patient? Well, remember, it's like extreme, sudden, severe heart failure. So you've lost all perfusion forward, okay? So what happens when we don't perfuse the brain? We get decreased LOC. What about when we don't perfuse the kidneys, right? We get decreased urine output. What about decreased perfusion to like the skin and the legs? We're going to have decreased pulses. They're going to be cold, pale, right? Makes sense? It's all decreased perfusion. This is your number one clue. Now, we may also see problems with fluid backing up, right? This is heart failure, so we can have this backup of fluid as well into the lungs. We'll see this pulmonary edema. We'll see shortness of breath, right? We might hear some crackles. So decreased perfusion as well as fluid going backwards. And then, of course, what happens when fluid goes backwards into the body? We get this jugular vein distension, JVD, right? So back up into the body, back up into the lungs, decreased perfusion to the brain, the kidneys, the skin. All of those things are your signs of of heart failure. And so with cardiogenic shock, it's like extreme heart failure. So keep that in mind as we go forward. So when we start thinking about treating a patient in cardiogenic shock, the most important thing to do is identify and treat the cause. So if this is an MI, they might need revascularization, like we talked about in the MI lesson. If it is a cardiac tamponade, then we want to remove the fluid from around their hearts. And then if it is a pulmonary embolism, then we want to bust up that blood clot. So if we don't address the cause, then nothing else we do is going to be effective, okay? Now, when it comes to medication, the big goal is to get the heart pumping more effectively and to decrease the pressure it has to pump against. So the top two drugs we give for this are going to be dopamine and dobutamine. Both of these are going to increase contractility. Dopamine will also help to increase the heart rate, and dobutamine also allows for some vasodilation, which helps to decrease our afterload. Now, if they had an MI, they'll also get Mona. Mona always comes along with her MI patients. If the patient has developed severe pulmonary edema, we may give them diuretics like furosemide to help get some of that fluid off. We just want to take caution here because remember, in shock, a lot of times they have a low blood pressure. So we don't want to drop their blood pressure too low. So there's lots of nursing priorities for this patient, one of which being that this is shock. It's an emergency. They need to be in an ICU. But let's focus on the top three concepts here. If you check out the outline and the care plan attached to this lesson, you'll see a ton of details about specific interventions. The first concept is perfusion. We got to monitor their hemodynamics and maintain a good cardiac output. Then, because these patients are at risk for airway and breathing issues, we want to monitor their oxygen status and intervene as necessary, maybe give O2, or they might actually even need to be ventilated. And then I added clotting because this condition might be caused by a PE or an MI, both of which are clots in either the pulmonary vasculature or in the coronary arteries. So we need to consider the interventions related to managing those conditions as well. So let's recap. Cardiogenic shock is caused by a broken or a blocked pump that might be an MI, cardiac tamponade, or pulmonary embolism. Most of the symptoms are caused by this decreased perfusion to the vital organs and by the backup of fluid into the lungs and body. That's why you see that pulmonary edema and the JVD. Again, it's like extreme sudden heart failure. Our goal is to treat the cause as soon as possible and get that heart pumping harder against less pressure. So increased contractility and decreased afterload. Our priority nursing concepts are going to be perfusion and oxygenation, and then dealing with any clotting or bleeding issues depending on the cause. And finally, remember that this is an emergency. These patients need to be in an ICU and may even need to be on life support. So don't be afraid to ask for help if you need it. Call rapid response. Get that patient where they need to be. So make sure you check out the care plan and the outline in this lesson to see lots of details about nursing interventions and nursing care. We love you guys. Go out and be your best selves today. And as always, happy nursing.